Hey everyone, this video is all about the logical reasoning questions in section 1 of UMAT. So logical reasoning is one of the three subsections we have for section 1. You can see it's just down here, and I've just got the one video based on it because I think it's a fairly narrow scope of questions. In other words, we can cover pretty much all of it in the course of one video. The general approach is pretty similar. We'll just go through a few tips before we start tackling some questions. So first up point there is saying basically there are two approaches people tend to take with these questions. One is to go from top to bottom. So in other words, you begin by reading the passage, and once you've done that, you go to the question. The other approach is to begin with the question and use that to identify the relevant bits of the passage and just pick out the parts you need. There's merit to both techniques, and it's really a personal preference. So I think if you've got a bit of time to prepare before the exam, give both a try and see what you prefer and what you find is faster and more efficient. It might also depend too on the nature of the question. If it's a very broad, general question, it's hard to focus in on a particular part of the passage. Whereas if you've got a very specific question, it can be useful to read that question first so that you don't waste a lot of time reading the whole passage. But just play around with that, see what you find is better for you. Second dot point, pretty straightforward. Read everything carefully, underline the relevant parts of the question and the passage, that should say, and sketch on the side of the page to help yourself visualize the problem at hand. So most people tend to think pretty well visually, and you're allowed to sketch on the side of the page and of the booklet. So please do so. However you think through a question, whether it's through arrows, flow diagrams, little sketches, diagrams, just do it on the side of the page. It'll make a big difference. Third dot point, again, pretty straightforward. Just be careful with the finer points of the language used in each of the answers and compare it with the passage. So it really is about being very, very careful with the finer points of the language used. Fourth point is a pretty big one. It's about keeping it within the scope of the information given to you. So the idea of UMAT is that you're not meant to bring in a great deal of external knowledge. All the information you need should be on the page there somewhere. So when you're going through the answers, ask yourself whether each answer is within the scope of the information given to you, as opposed to if it's outside the scope. In other words, if you have to make assumptions for it to be true. If that's the case, then it can't be the correct answer. So keep it within the scope. The fifth point here isn't a major one. It's more if you're kind of guessing between two options. And it's that more sort of general and open-minded answers are more often correct than definite answers. So what I mean by that is if you have words like maybe, could be, is possibly, words and phrases like that tend to suggest that answer is more likely to be correct compared to answers where there are words like is definitely, will be. Very definite phrases like that lead to what are more often incorrect. That's not a thing to go on. There are times when definite answers are correct. It's more just of a guessing technique if you're down to 2 or 3 and you can't quite be sure. Now this final point is just about being familiar with a few sort of public health and research terms. Now, as it says at the bottom here, if you get thrown a term like false positive or placebo in the real exam, they should provide some kind of definition or explanation. But it is just good to know what it is beforehand because it does take some time to get your head around it. And in the middle of the exam, that's not really what you want to be doing. So a few good terms to go through. Randomized control trial, that's just when any kind of study, any research study, has several groups of people and each group receives a different treatment and they follow over time and see how they turn out. Double-blinded, that means that both the participants in the study and the doctors or the people administering the treatment don't know what treatment is being given. So in other words, if there's one group getting a medication and another group getting a placebo, neither the patients nor the doctors know who's getting what, just to reduce the bias. Sensitivity and specificity kind of go together. Sensitivity is referring to how sensitive a test is for picking up a certain disease. So if you have 100 people who actually have a certain disease and you run a diagnostic test on those 100 people and it says that 80 of them have the disease, the sensitivity is 80. So the higher the sensitivity, the more sensitive a test is in terms of picking up a certain disease. Specificity is kind of the opposite. It's if you have a room of people without a disease and you run a test on them, how many people will that test say don't have the disease? So it's a measure of kind of the negative outcomes. Now, false positives and negatives are, again, are kind of a pair. That's referring to test results which are positive or negative falsely. So false positive is when you don't have the disease, but the test says you do. False negatives is when you do have the disease, but the test says you don't. And just finally, placebo. Now, I think most people have a vague idea of what a placebo is. It's basically a sugar pill or a pill with nothing in it, or some sort of treatment where there's no actual active ingredient or treatment. And it's there really to measure the psychological effect of taking a tablet or having some sort of treatment given. So the thing to be careful of there is a placebo is not the same as receiving no treatment whatsoever. The idea of a placebo is actually to measure the effect to which the psychological aspect of having a treatment contributes to the overall effect of a medication. That's the use of a placebo group. So quite a bit there, but as I said, if they do use any of these terms or other terms, they should give you an explanation in the real exam. It's just good to have a bit of an idea of what they are before getting into the real paper. So we'll get on to the first question now. So take a minute to look at this question. I should say too, if you're still a bit unsure of what I mean by logical reasoning questions, they're basically just comprehension. So often you'll just see a paragraph of information. It may be scientific or it may be something totally different, but it's all just a case of reading between the lines, being very careful, and as the name suggests, reasoning logically based on the information given to you. So this is a classic kind of logical reasoning question. You can see that there's a lot of information here, and I think when you've got lots of different components here, the best thing to do is just to sketch up a diagram basically. So I'm going to do that now just to illustrate what I would do personally on the side of the page. Obviously it depends on how you think. So you can see when product A binds to the outside of a cell, it triggers a series of reactions. So first of all, it activates a molecule called SP1. So I'm going to sketch up a bit of a cell here, and we'll put on the outside just this molecule A, the product A, and on the flip side of the cell, on the inside, we've got it activating a molecule called SP1. So we'll put SP1 there. Oop. Okay. So let's see where it goes from here. SP1, which is responsible for splitting NK2, a protein, into two subunits, NK2A and B. So I'm just going to put an arrow here to NK2, or sorry, to NK. So I'll put NK2, and then it says that splits NK2 into its two subunits. So I'm going to say that from here we split NK2 into two subunits. One of them will be NK2A, the other one will be NK2B. So NK2A. Sorry, not the best writing here. NK2B. There we go. You get the idea. Now the NK2B subunit activates AC10. So again, off the NK2B, we'll just do another arrow and another box, and we'll just say that's AC10. And it says that AC10 stimulates the production of an enzyme TFAs. So again, one more arrow, we'll just put TFAs here. I'll just put TFA for short. Now, TFAs is responsible for producing ATF from TF. So it's responsible for converting basically from one enzyme to another. I'm just going to put down here just an arrow like this showing that that TFA or TFAs is the one responsible for converting TF into ATF, as we've got up here. Now there's a few more bits of information. So it says another protein, GB1, readily binds to SP1, rendering it inactive. So SP1 is back here at the start. So I'm just going to draw up GB1 here. And again, there's no rules as to how you need to draw it up, but I just think of it as this way. I put a little line here and then just put something like this to show that GB1 inactivates. So this means it inactivates SP1 and stops all of this cascade happening. Now the last part here is the protein GB2, which again we haven't seen yet. converts AC10 into NK2B. So that's this reaction here. We can see that we've gone downstream before from NK2B in the direction of AC10, but we can see this new protein, GB2, makes the reaction go the other way around. So I'm going to put an arrow back the other way from AC10 to NK2B, and I'm going to put a line here just to say that that reaction is catalyzed or is created by the protein GB2. So I'll put GB2 there. So this is what I'd have on the side of the page. It might take a minute or two to sketch up, but once you've got that, it makes this question and any subsequent questions much more easy and simpler to do. So the question is, greater quantities of which of the following would increase the production of ATF? So have a look where ATF is. It's right at the end here. You can see that it's kind of downstream, as I like to say. It's kind of right here on the right, having been the end product of all of these reactions coming downstream. So let's have a look one by one and imagine if we increase the quantity of each of these, what would happen? So GB2 is this one here, which remember creates an effect where AC10 here gets converted back into NK2B. So if we had more GB2, then this whole sort of system would shift more towards the left. It would shift backwards away from ATF down here. Because remember, the more AC10 we have, the more TFA we have, and the more TFA we have, the more ATF we have, which ultimately is what we're looking for given what the question is. So anything which decreases the amount of AC10 by bringing it back upstream this way will have a counter effect. It'll make less ATF. So A is not correct. B, GB1, again GB1's here, and if we remember from before, that stops SP1 from having its effect. So it basically stops any of this happening after SP1. It kind of cuts the reaction off around here. So if GB1 is more prevalent, then there'll be less of everything produced, including at the end ATF. C, NK2A. Well, you can see NK2A is off here on the side, and it's kind of a dead end. There's nothing that comes from that. The real reaction happens down from NK2B through here. So increasing NK will have no effect on ATF. There's no connection between the two. So therefore that one's incorrect too. And just finally D, which we assume must be correct at this point, AC10. Well, as you can see, if there's more AC10, as I mentioned before, there's more TFA. If there's more TFAs, then that means that more TF is converted into ATF, and therefore you'll get more production of ATF, which is what the question is asking. So for that reason, the answer would be D. You can see here, though, that even though it took a lot of time to create this diagram, once you've got it, it makes it a lot easier to visualize what's happening. I think it's much quicker than having to go through all these different terms 4 times over for each answer just to work out what's happening. So it's well worth the investment. Question 2 is more of a straightforward comprehension. Pause the video for a minute and just see if you can solve it. Really, it all rests on this final statement. You can see that the active ingredient in Natural Remedies St John's Wort is used by more than half of all hospitals in Australia. So there's a couple of little tricks in this statement, and this is where the careful reading I mentioned before really comes into its own. We really have to read everything and understand the finer details of it. So in this statement we can see that it's the active ingredient that is used in hospitals rather than St John's Wort. That's the first big thing to pick up on, is that distinction between St John's Wort itself on the one hand and the active ingredient of St John's Wort on the other. So those are 2 different things. And that means that St John's Wort itself is not necessarily used in more than half of hospitals. It's just the active ingredient. The other thing to pick up on here is the fact that it doesn't really tell you what the active ingredient is used for. So, I mean, we had a few symptoms mentioned above in terms of what St John's Wort can be used for. But we have no idea if the active ingredient is used for the same things or if it's used for something completely different. So we don't know what it's used for. All we know is that active ingredient is used in more than half hospitals in Australia in some capacity. So that's just the importance of reading carefully. So now if we go through the statements, option A, so more than half hospitals in Australia use St John's Wort for some purpose. So that's really a rewording of the statement, except that it's not including the bit about the active ingredient. So it goes back to what I mentioned a minute ago, how there's a distinction to be made between St John's Wort itself and the active ingredient in St John's Wort. They're 2 different things, and because this option A doesn't mention the active ingredient, it just mentions the St. John's wort itself, that's incorrect because it's inconsistent with what this final statement is saying. Option B is wrong for the same reason. It's really just reworded with a few negative terms, but it's the same idea. And because it's saying St. John's wort rather than the active ingredient in St. John's wort, it's incorrect. Option C. Now this is better already because we've got the active ingredient. So the wording is the same. In St. John's wort is used to treat inflammation or depression or depression in more than half of hospitals in Australia. So it starts off well, but it kind of falls down in the second half because it mentions treating inflammation and depression. Now that's similar to what we have up here with inflammation and stabilizing mood. That's passable, but the issue is that we don't know down here in this statement what the active ingredient in St. John's wort is actually used for in hospital, because the active ingredient might be used for something totally different from inflammation and depression. So because we're not given that, we can't make that assumption. We have to keep it within the scope of what we've been given here in the passage. And for that reason, C would be wrong too. So given you've got this get out of jail option here, the none of the above, I think given the first three options are not really satisfying all our conditions, we have to go for D. So D is still the best option out of the four here. Question 3. Again, just a pretty straightforward comprehension, so pause the video and take a minute to read through it and see if you can come to an answer. So the question is, which of the following can be concluded? Option A, doctors should be suspicious of infective endocarditis in patients with a history of structural heart disease experiencing fatigue but no chest pain. So it's a reasonable option, I think. Certainly, it mentions patients with a history of structural heart disease, which is mentioned here as a risk factor for infectious endocarditis. Sorry, there it is. So that's a good start. Now, the symptoms mentioned are fatigue, but no chest pain. And again, that's pretty consistent with the information. Even though you might think chest pain could be a symptom, given it's relating to the heart, if we go through the clinical presentation here, fatigue is mentioned, but there's no mention of chest pain. So again, keep it within the scope of what you've been given, and given what we have here, that's pretty consistent with infective endocarditis. The wording of option A is also quite nice and general. It's saying doctors should be suspicious rather than doctors should diagnose or doctors can be certain of. It's saying that doctors should consider this. It should be a thought they have, but it's not definite. That's a nice general wording. So all in all, that's a pretty good option. With a lot of these logical reasoning questions, you won't have an answer which is definitely right. It's more a case of reading through all four and finding the best option out of those. So at this point, I would say A is pretty good, but let's keep going through and see if we can find something even better. With B, the increase in average patient age is due to the advent of indwelling cardiac devices. So again, important to keep within the scope of what you've been given. It does mention an increase in average patient age, and it does say that indwelling cardiac devices are a risk factor, but we can't say that the increase in age is due to that. There's no causal link identified in the passage, and there are quite a few risk factors apart from that. So we really can't say with certainty that that is the main or the sole contributing factor there. So at this point, I think A is a better option than B still. With C, patients who present with symptoms including fatigue and fever should be started on antimicrobial therapy as a precaution. So the wording here is very definite. It's saying that they definitely should be started. Now there's no real mention of, it mentions that there is antimicrobial therapy is generally sought, but it doesn't really say if it's done prophylactically, in other words, if it's done as a precaution before a diagnosis is made, or if it's only started once a diagnosis is made. So you really need more information about how the condition is managed and diagnosed to come to a conclusion about whether or not they should be started as a precaution, particularly with fairly vague symptoms like fatigue and fever, which could be a range of other things. If maybe it's said older patients who have a history of structural heart disease and valve replacement come in with fatigue and fever, then maybe you'd think more closely, or you think it might be C. But it's a very vague answer in terms of symptoms, and it's a very definitely worded question in terms of it saying patients should be started, and there's really no indication of that down here in the bottom where it talks about the different therapies. Now D, surgical removal of affected parts of the heart tissue is one of the treatment options. Again, it's not really stated in the passage. It says surgical intervention, but we don't know if that intervention includes removal of the affected parts of the heart. So for all we know, it could be a completely different intervention which doesn't include that. So it's just again about keeping it within the scope of the information given to you. So given all of that, I still think A is the best answer here. It's again that thing of working out the best out of the four. You won't be definitely sure when you first read it most of the time, but it's an evaluation thing once you go through all four. So in this case, I'm going to say that the answer is A. Just one more quick question based on the same passage. So the new question is, which of the following, if true, would not be a possible reason for the doubling of the average patient age in infective endocarditis? So it's referring back to this part here where it says that there is a doubling of the average patient age. So there's a couple of things to point out in the question here. The first is just that word not, which is pretty straightforward, but it's amazing how often people stumble over it. So remember, we're looking for the one which would not be a possible reason. The other thing is the wording here with if true. So what this is saying basically is it's basically giving you license to ignore keeping things within the scope of the question. It's saying we've got four suggestions here in our four options, which are, as I said, suggestions as to why the average patient age may have doubled. You don't need to find any evidence of whether that could be true in the passage. You're kind of given license to assume that it could be true. And therefore, the real question is just whether each of these answers would have an effect on the average age. So in other words, it's not a case of working out whether they are true and whether they are mentioned here. It's more a case of just seeing if they could lead to the outcome that we're looking at and we're interested in, which is the doubling of the patient age. So that might be a bit confusing, but hopefully I'll clarify it as we go through the answers. So with A, life expectancy has increased significantly over the same period. So with this answer, we're not looking for any evidence of the fact that life expectancy has increased. You won't find any in the passage, but that's okay because the question is saying which of the following, if true. So again, it's giving you that license to assume that it's true. And the real question here is just whether that increase in life expectancy would also have an effect on the doubling of the patient age. Now, I think that'd be a reasonable assumption. I think if life expectancy has increased, if people are living longer, then over the course of a few decades, that would be a reasonable reason why the average patient age may double. So I think that's a reasonable reason. So for that reason, it's not the correct answer because remember, we're looking for the answer which would not be a possible reason. So it's that negative, that word not, which flips it on its head. So because A could be a reason, it's not the correct answer. With B, the advent of indwelling cardiac devices, which are used mainly in older populations, has created a new risk factor for infective endocarditis. So again, we don't have to worry about whether this is all consistent, whether cardiac devices are used mainly in older populations and whether that is a risk factor. We're just taking that that's true. If it is true though, the question is, will that have an effect on the average patient age? And again, I think it probably would, because if you have a risk factor, which is in this case the devices, and that risk factor is mainly in older populations, as stated here, then that would be a reason why older populations may experience endocarditis more often, and therefore the age would or could double. So that seems to be a reasonable option. And again, for that reason, it's not the answer, because we're looking for the answer which would not be a reason for the doubling in age. With C, diagnostic techniques have improved considerably, allowing for diagnosis at an earlier stage. So with this one, if anything, I would say that would make the average age earlier, because if you're diagnosing at an earlier stage in someone's life, that would be obviously an earlier average age over the whole population. So this is one where it actually seems to go against the question. It seems to be a reason why the average age would become earlier or younger rather than later or doubling. So for that reason, I think it's not a reason. It's not a reason why the average age may double. And for that reason, it's actually a good answer because we're looking for the one which would not be a possible reason. So C is looking pretty good. Just finally with D, several campaigns have highlighted the importance of investigating for the disease in older patients. Again, that would kind of shift the focus towards the older population. And if there's more focus and more investigation of the disease in those patients, that would lead to an increase in the average age. So that is consistent with the doubling. So that is not the correct answer. And I think the best out of the four is still C in terms of which of the following wouldn't be a reason for the doubling in age. So the two things there are really just the word not, which comes up quite a lot in the real paper, so keep an eye out for it, and the wording of if true. So just get that idea of if you see that, it gives you license to forget about whether the answers are within the scope of the passage. It's just about whether they are consistent with what it is you're looking for in the question. So in this case, the answer would be C. Next question again is just a lot of reading, a lot of comprehension. I won't go through and read all this, but by all means, pause the video and take a couple of minutes to do so. The question is just which of the following can be concluded. So if we go through the answers, A, the first recorded use of fossil fuels is 1100 BC. Now you can see here there's a statement saying that records of the use of coal date to at least 1100 BC. Now, so that's pretty consistent. The only issue here is that it's talking about coal, whereas in the answer it's talking about fossil fuels as a whole. And as you can see from the first sentence, fossil fuels include coal, oil, and natural gas. So even if coal was around 1100 BC, there may have been recorded use of oil or natural gas prior to that. We can't discount that just from the information given to us in the passage. So for that reason, it's probably not the best answer. But as always, go through all four and just try and pick out the best of the four. So with B, efficient production of fossil fuels was a key driver of the Industrial Revolution. Now, I can't find any evidence or any mention of the Industrial Revolution in the passage. So I think with B, it's one of those answers where it sounds pretty good just based on your prior knowledge. So it's really testing to see whether you understand the importance of keeping things within the scope or whether you're bringing external knowledge into it. So even though it may sound good based on what you know, it may sound plausible. Because there's no mention of the Industrial Revolution, it can't be the right answer. With C, the invention of fire bricks led to an increase in the household use of coal. So this really comes back to the sentence here. The invention of fire bricks in the 1400s made chimneys cheap to build and helped create a home heating market for coal. So I'm thinking C looks pretty good because it's pretty much just a slight rewording of that sentence. It's saying the invention of fire bricks, and we've got here the invention of fire bricks, led to an increase in the household use of coal. And then we have helped create a home heating market for coal. So it's a very slight rewording, but I think it's a very small jump to make and a very reasonable conclusion to make that given it created a home heating market, as it says here, that means that it increased the household use of coal. So C is looking pretty good at this stage. Just finally, the Chinese population were refining crude oil in approximately 1000 AD. So that kind of comes back to this section here, where it says that, it talks about Mesopotamia in around 3000 BC, and then says 2000 years later, the Chinese refined crude oil. So the only trap here really is that 2000 years after 3000 BC would be 1000 BC, and the answer says 1000 AD. So that's the little trip there. Otherwise, that answer would be pretty reasonable, I think. So out of the four, C is definitely looking like the best option. So that would be the answer. So again, just pick up on the key ideas here, which are keep it within the scope, read everything very carefully, including kind of the finer points of umbrella terms like fossil fuels versus the individual things that make up that, and also just things like the units or the particular numbers used. All those little things are key areas where they can try and trip you up. So careful reading is the key. Now question 6, this one is still a logical reasoning question, but there's a bit of a data flavour to it. You can see that we're talking about, or rather the passage is talking about different studies and giving quite a few numbers. So it's a little bit different in style, but the same principles still apply. Now I'll take a few minutes to just go through the information in the passage because there are quite a few pitfalls that I think it's important to point out. If we start at the top, that first sentence really is just saying that we're dealing here with data obtained from patients who have inflammatory bowel disease, which is IBD. And it just says that that's a term which encompasses both Crohn's and ulcerative colitis. So Crohn's and ulcerative colitis are two different diseases, but together they are kind of grouped together under the umbrella term of inflammatory bowel disease or IBD. So when you see those three different terms, IBD, Crohn's, and ulcerative colitis, keep in mind how they relate to each other, because that'll be one of the traps in this question. Now the next couple of sentences which make up the middle part of the paragraph are a bit complicated. So the first one says that the IBD patients, so we're dealing with both Crohn's and ulcerative colitis, were divided into 3 groups based on age, and you can see the age ranges there. And then it says that for each of those 3 age ranges, they calculated the participation rates, which is the percent of patients who volunteered to participate. And they were respectively 33, 12, and 12.5. So in other words, the 20 to 25 year group had the best rate at 33%, and then the other 2 groups had roughly 12%. That's what the middle part is saying. The trap here, though, is that the second sentence here just mentions Crohn's, not IBD. So it's only mentioning half of the participants, or roughly half, because we haven't incorporated the ulcerative colitis group too. So that's the trap there. You can't quite put the 2 sentences together because the first one deals with IBD as a whole, and the second one deals with just Crohn's. That's the big trap there. Now the final sentence is talking about relapse rates over a 20-year period, and it's saying that those between 20 and 30 have a better or have a more improved rate of relapse than the 30 plus group. I guess the trap here is to think that given the younger group in this sentence had the better relapse rate improvement, and given in the previous sentences we saw that the participation rate was better in the younger groups as well, that maybe you could make some kind of connection between the participation rate in trials and the relapse rates. There's a couple of reasons why you probably shouldn't do that. The first is that the age ranges are different. Here before we had the 20 to 25 year group, which was the one which had the really good participation rate, whereas down here the best age range in terms of relapse rate improvement was the 20 to 30 year group. So it's a different range of ages for one thing. The second thing is if you read carefully this final sentence, it's dealing with ulcerative colitis, whereas in the previous one, the previous sentences were about IBD and Crohn's. So there again, it's talking about a different aspect of IBD as a whole. So you can't quite make that connection there. The other thing is even if those 2 previous points I just made weren't the case, it's still a big jump to say that just because a certain group of people had a better participation rate, that means that they had lower relapse rates. It's a bit of a jump to make that connection entirely. So with all that in mind, we'll go to the question. Which of the following is the best conclusion? So option A, participating in clinical trials reduces the risk of relapse for IBD patients. So the reason why that one is wrong is really what I've just gone through before in terms of you can't make that connection because the wording here is different between IBD, Crohn's and ulcerative colitis, and the age groups are different between 20 and 25 and 20 to 30. And even if it wasn't the case, you would still have trouble because it's a big jump to make to say that that is the cause of something. So for all those reasons, option A is probably not the best answer. With B, for IBD, the 20 to 30 year group demonstrate lower relapse rates than the 30 plus year group. That would be fine, except that in the answer we've got IBD, and in the passage we're talking just about ulcerative colitis in this final statement which is consistent with option B. So because that's not the same thing, we can't conclude option B. With C, more people participated in the IBD clinical trials. I'll stop right there because all we have in the passage is talking about the percent of patients. So it's a proportion, it's a percentage. Whereas option C is talking about the raw number of people who participated. So it's that idea of raw numbers and proportion being quite different things, which is a concept we'll go through in a later video on data. So I'm guessing option D is probably the best. We'll have a look at it. The use of clinical trials may have contributed to improvements in relapse rates in IBD over the past 20 years. So that's a pretty reasonable option because obviously there have been clinical trials given we've got data on it, and there has been an improvement in relapse rates in IBD over 20 years, as it says here in the final sentence. And the wording of this option is very, very general. It's saying that they may have contributed to improvements. It's not saying it's the only thing that's contributed. It's just saying that it may have. So I think out of the 4, option D would be the best. Question 7. Again, this is a bit of a different style, which is why I've included it. Take a minute to pause the video and read through that passage at the top. It's quite confusing because a lot of the words are repeated a few times. And it's difficult to visualize, but see how you go. So what we have here is some system where for any given application, that application will be noted, considered, and recorded in some order. But depending on what that order is, the outcome can also be different. Now, as you can see from the passage, there are 3 sentences there, and each sentence gives us a different order or a different system that can be done for an application. So what I'm going to do is sketch down the bottom of the page just those three different systems to help better visualize how this can all occur. So the first one is just that first sentence, which is saying that an application is recorded on the day that it is noted. So I'm going to begin by just drawing an R and an N on the same level. So what I'm doing is basically drawing or sketching a diagram about how things happen over the course of time. So the earlier something happens, the higher up I'll put it, and as time progresses, I'll work gradually downwards. So because it says here that an application is an application is recorded on the same day it is noted, I'm putting the N and the R for noted and recorded on the same height, the same level. Now this is on the condition that it is noted after it is considered. So I'm going to put C above the N there. So this is one possible order of events. Now the second sentence says, if an application is considered but never noted, it will not be recorded. So if it's first considered, but then it's never noted, so I'm going to write C at the top and then an N, and then cross out that line, because we never get past the point of being considered, then it is never recorded. So again, I'll cross out that line to say that it's never recorded. That's a second possibility there. The third, as the third sentence says, an application that is noted before it is considered, so I'm going to put an N at the top and then below that a C, will become recorded once it is considered. So it will become recorded at this point too. So now that we've got this, it's much easier to see how things can occur in different orders and what the outcome of that is. So going to the question, option A, the question first. An application was noted on June 4. Which of the following must be true? So we can see that in each of these cases, we're looking at the N for noted. I'll just circle them here. Well, actually, in this case, it wasn't noted in the second sentence, so we'll cross that one out altogether. But I'll just circle the N for noted in each of the other two situations. Now that was on June 4, so which of the following must be true? Option A, the application can't be recorded until June 4. Well, that seems to be pretty true because in this case here, the application is recorded on the same day as it's noted, which is June 4. And in this situation, it's recorded after it's noted, which is June 4. So either way, it's being recorded on or after June 4, but it's not before June 4. So if you read option A again with that in mind, it can't be recorded until June 4. That sounds pretty good to me. We'll just keep going and see what the other ones say. Option B, the application becomes recorded on June 4. Well, as I just mentioned, that might not be the case because in this situation on the right, it can be recorded at a time after June 4, so not necessarily on June 4. That's why B would be wrong. C, the application has not been considered until June 4. Well, again, that can be incorrect because in option A here you can see that an application can be considered before it's noted, and therefore it could have been considered before June 4, therefore C is wrong. Option D, the application was considered sometime before or on June 4. Again, that could be wrong because as we can see from this third situation, it can be considered after a date where it is noted. So it hasn't necessarily been considered before or on June 4. It could be afterwards. So for those reasons, I'd say the best out of the four options here would be A. But you can see the importance again, just like the very first question in this video, of just sketching out a visual depiction of a complex system to help clarify what's going on and the different possibilities. Question 8, same stem, different question. So I'll just write up those three different possibilities again. It's all the same information. So we've got the first situation, which is application recorded on the day that it's noted. So noted, recorded, that's in the condition that it is after it's been initially considered. Second situation is considered but never noted. So again, we'll cross that out there, put the N there. It's never recorded, so just the same as before. Third situation, application that is noted before it is considered will become recorded once it is considered. Okay, so the question now is, if an application has been recorded, which of the following must be true? So our focus now again is on the R rather than the N as before. And it can't be possible with this second setup because you can see we never get as far as recording if it's never noted. So that can be crossed out. So if an application has been recorded, which of the following must be true? Option A, it has either been considered or noted, but not both. Well, that's not true because it can be both considered and noted before it is recorded. That's shown by both the first and the third situation where you can go through these two steps before being recorded. So A would not be correct. B, it has been both considered and or noted. That looks pretty good to me because remember, uh, this so in this situation it's considered first and then noting and recording happens on the same day. Likewise here with the third situation, it's noted first and then considered and recorded on at the same day. So in both of these situations, at least one event has happened. In this first situation, it's been considered and it may have also been noted, but not necessarily because it is on the same day. So the order of these two can be swapped around because they are on the same day. Likewise here, if it's this situation, the application has been noted and it may or may not have been considered based on whether the consideration or the recording happened first on that particular day. So option B looks pretty good. It fits both those pictures. With option C, it has been considered first and then noted. Well, no, because you can see in this situation here on the right, it can be noted and then considered. And with option D, it has been noted first and then considered again. That is incorrect because the first situation shows the opposite order. It shows being considered and then noted. So for those reasons, I would say that the answer would be B. Final question now. This one again has a bit of a data flavour to it. So take a minute to read through that passage and have a go at it. So we can see we're dealing with a new blood pressure medication, and you can see it's being investigated through a double-blinded, randomized controlled trial. So if you recall from the very first few slides, double-blinded means that both the participants and the people running the trial aren't sure which people are getting which treatment. And the randomized controlled trial just refers to basically a study where there are a few different groups of people and they each get a different treatment. Each of the groups get a different treatment. So in this case, there are three groups. One get a placebo pill, one get the old medication called Presnod, and one get the new medication called Presnu. And after 6 months, the three groups have their blood pressure measured, and the average reductions are 2%, 6%, and 8% respectively between the placebo, Presnod, and Presnu groups. It also mentions some side effects, and you can see the side effects are also 4%, 8%, and 12% respectively. So the placebo group had both the lowest drop in blood pressure, but also the lowest side effect profile, whereas the Presnu, the new medication, had both the highest average drop in blood pressure, but also the highest side effect profile. So given all of that, which of the following is the best conclusion? Option A, the purpose of the placebo group is to demonstrate the effect that having no treatment would have. I kind of alluded to it earlier, but the effect of the use of the placebo group is actually to demonstrate to what extent taking a tablet has a psychological impact on you. So it's not showing you the baseline if you have no treatment. It's actually showing you to what extent the success of a blood pressure tablet, in this case, is down to the psychological effect of having a tablet, and to what extent the effect is due to the actual biological or physiological effect of the ingredients in the tablet. That's what the placebo does. It shows you how much of it is psychological and how much is biological. So A is not correct for that reason. With B, Presnu is the superior choice to Presnod as a medication for blood pressure over 6 months. There's quite a lot to like about this answer, because obviously Presnu had the better reduction in blood pressure, and it does specify blood pressure in the answer, and it mentions 6 months, which is the end point in terms of time mentioned in the passage. The problem I have here is that the wording of superior choice is very vague and subjective. For one thing, the Presnu group had a higher side effect profile compared to, or side effect percentage rather, compared to the Presnod. So even though it dropped blood pressure more, it also had more side effects. So it's kind of a balancing act as to which medication is superior given that. The other thing is we don't really know how much, we don't really know whether that 8% reduction on average was across the board, or whether it was a few individuals who had a big drop and the rest didn't, just as an example. So we don't really know enough about what the goals were in terms of blood pressure and how many people were affected. In short, there's just not enough information, and given the subjective nature of the word superior choice, I think it's probably not the best option there. With C, assuming the average starting blood pressure was very similar between the three groups, the Presnu group will have the lowest average blood pressure of all three groups at the 6-month mark. So this one looks even better to me, to be honest. It's giving you the assumption at the start, which means that's good. That's saying that we can assume that all three groups had a very similar blood pressure at the start. And as is given in the passage, we know that Presnu had the lowest average drop of 8% out of the three medications. So it's only fair to assume or to conclude that of those three groups, at the end of the 6 months, the Presnu group will have the lowest average blood pressure. That seems pretty good to me. And just finally, D, the frequency of side effects is more important than the severity. Again, that's very subjective. There's really no way of saying that could be true, and it's just really outside the scope of the question. So based on all that, I think C would be the best answer here. Again, it just comes down to careful reading and evaluating kind of the wording of the question versus the passage. That's it for this video. I think the tips I went through at the start on the basics slide really should be enough for you for almost all logical reasoning questions you get in section 1 of UMAT. And I think over the course of these 9 questions, even though it's on a big video, I think it does show the scope of questions you're likely to get in logical reasoning. So all the best. Hope it helps.